B12 is absolutely critical to have in sufficient amounts in your body, and many people are struggling with a B12 deficiency that's causing tons of different symptoms. So that's why in this video, I'm going to teach you everything you need to know on how to get optimal amounts of B12 in your body, but also the top 10 warning signs that you very well may be struggling with. Hi Wellness Warrior, I'm Dr. Zyrowski, and B12 is so critical to your overall health, so that's why we're discussing it today. In fact, many people are deficient in B12, and most people don't even know why it's happening, but you're facing those symptoms, it's interrupting your daily life, and you're going, where is this coming from? Well, it might be B12, so let's dive in. So first of all, what is B12? So B12 is actually interesting. So a couple interesting facts about it is that B12 is also called cobalamin. It can be stored up to 3 years in your liver. So meaning that your liver will store up to 3 years worth of B12. So it seems like, well, how in the world could we ever run out? Well, it still happens. Now, another interesting fact about it is that if you start to consume too much of it, you'll just excrete it out through your urine. So it's very hard to reach some dose of B12 in your body that's going to be dangerous. Now, as we look at B12 and what it actually accomplishes in your body is, first of all, it's very important for healthy functioning nerves. Number 2 on our list of things that B12 does in your body is that it's required for red blood cell production. And then lastly, it's critical for your DNA. So here's the thing that's so interesting. Of those 3 things that we just mentioned, it's like your DNA, your neurological function, pretty important stuff, right? So we have to make sure that we have optimized levels of B12. Otherwise, our entire body can start going haywire. I mean, when you start talking about the control system, like your nervous system not working correctly, your DNA, like your genetics not working correctly, that's some pretty serious stuff with very serious consequences. So how in the world could you become deficient? So, well, there's a lot of ways. Let's go ahead and go through some of them. First of all is that you're not breaking down your food properly. This is very common because so many people are struggling with an unhealthy digestive system. And so when you consume your food, your digestive tract is unable to break it down appropriately, extract those nutrients out so that you can get optimal levels of B12. So therefore you end up with a B12 deficiency if that's not happening. Now the other reason is that you lack intrinsic factor. Now this is something that is necessary in order to help you break down B12 so it can be utilized from the food that you're eating. So if you don't have this, then this is a very serious problem. Now it's very common in people who have gastrointestinal issues. So let's say you have ulcerative colitis or inflammation in your gut or Crohn's disease or many of the other gut issues that many people are facing today, including possibly even you. It's very common that you'll end up with a B12 deficiency as a result of this. Now, next on our list is a pH imbalance within the gut. So some common ways that you can know that if you have a pH imbalance in your gut is going to be like if you have a lot of bloating, a lot of gas, and excess burping. This is a common sign of that. And once again, you're just not breaking down that B12 so it can be utilized appropriately. On our list next is if you're taking medications, okay? There's a lot of medications and we can't go through all of them because there's a million of them out there that people take that can actually affect your B12 levels. So if you're taking medication, understand that it's not only B12, but it can actually be impacting so many different nutrients in your body. So that's why we always have to look at medications and realize they are not a gateway to better health. They have side effects to them as well. They may offer you some positive results, but the fact is they also come with negative. Now, let's also talk about if you're following a vegan or vegetarian diet. This is one of the most common reasons I see people with B12 deficiencies when they come to me. They're following a diet like this and their red blood cells are all screwed up because I mentioned that it is required for red blood cell production. So they're on this diet, vegan or vegetarian, their red blood cells are all screwed up, and what we have to do is we have to start pumping B12 into them in order to get that up. So if your diet that you're following is creating deficiencies in your body, there's a good sign that that diet is not a good diet for you. Now, next on our list is chronic stress. If you're someone who's always under stress, this is a reason. And then lastly, if you're elderly, it's estimated that 20% of elderly are suffering from a B12 deficiency. That's a big deal as you age, and having a B12 deficiency and the implications that come along with it we want to make sure that we're addressing this, because what happens when you're aging and you go to your doctor and you start to have all these symptoms, oh my gosh, medication, medication. However, the B12 deficiency was never addressed. Very dangerous. So that's how you become deficient. Now, let's talk about some of the warning signs, the symptoms that are associated with this B12 deficiency. First on our list is going to be weakness in fatigue. Okay, this is very common, and this is because once you start having a low amount of red blood cells, because it's required for red blood cell production, you start getting a decrease of oxygen carrying capacity throughout the body. You get a lot of fatigue and weakness. So we want to make sure that we're focusing on keeping this up. And this is why people who have deficiencies and they start taking B12 are like, oh my gosh, I feel like I just got my life back. The energy that comes with it is insane. Now, next is dizziness and breathlessness. So if you're somebody who feels like you can't catch your breath, you're having some breathing issues, you're kind of getting dizzy here and there, B12 deficiency, watch out for that. If your heart is racing, so if you notice that, out of nowhere, your heart starts beating really fast, it can be a sign of a B12 deficiency. And then the next thing on our list, and this one's really important because it literally changes your life. You start talking about, one of the worst things that can happen to you, that is a change in your brain that literally changes your whole world around you. Okay, and that's what happens if you have a B12 deficiency. You start to see changes in your brain, changes in your mood. Some of the things you'll experience will be depression. Okay, this is a sign, a common sign of a B12 deficiency. Anxiety is also up there. Now, also, if that wasn't bad enough, you can have forgetfulness and poor memory. Okay, all coming from a B12 deficiency. So you might think, wow, B12 deficiency is pretty simple to start increasing that, but most people don't know they have it. So here you are looking at these symptoms, like thinking about them and going, is this me? Okay, if this is you, you got to take action on this, because we're going to talk about in just a second some sources you can get B12 from, and of course the key secret to skyrocketing B12 in your body. Next is visual disturbances, because when you have a B12 deficiency, it is going to have implications on the optic nerve, which is going to affect your vision. And then changes in your tongue. So one of the things that can happen is if you get a B12 deficiency, you can get something called glossitis. And this is when your tongue becomes inflamed. And this is something that's going to have in a more severe case of B12 deficiency, but it's a symptom nonetheless. Now, the next thing is pins and needles in your hands and feet. So if you ever get that feeling, you're like, oh, I get this numbness and tingling. And some people, they associate that with so many different problems, but not something as simple as a B12 deficiency. So if you ever get that, remember, B12 deficiency is one of the reasons it will happen, pins and needles. Now, let's talk about what are some of the common foods that you can eat every day in order to increase your B12 level. Because whenever we consider having a deficiency, we want to always make sure that we're looking at food sources to increase it. We also talk about supplementation too, because if you have a deficiency, do you want to just slowly consume food for the next months and months and deal with all the symptoms, or do you want to take high doses of it and get it fixed right away? Well, really, you want to be doing both, right? Because we want to make sure that the deficiency doesn't happen again, so we fix our diet, but we also make sure that we're fixing all areas that could impact the B12 deficiency, right? Like our gut health was a big one that we talked about earlier. And so we can use food and supplementation in order to skyrocket it. So when we look at food sources, let's look at, first of all, red meat. This is a great place to get lots of B12. And this is why the folks on the vegan and vegetarian diet struggle with this, okay? They'll have a B12 deficiency guaranteed if they are not aware of it and counteracting it. Next on our list is going to be eggs, okay? This is not only a powerhouse of antioxidants and choline and so many different amino acids, but also B12. So make sure that you're eating your eggs. Fish and also dairy are good sources of B12. Now, for some folks, you can't do dairy. It's not good for you. It doesn't sit right with you. Even when you're consuming healthy dairy, it's just not in the cards for you to eat it. So if that's the case for you, look to some of these other sources. Now, whenever we're consuming any of these different products, like the meat, the eggs, we always want to make sure that we're getting grass-fed sources and good, healthy, sustainably raised animals, because they're going to have higher amounts of B12 versus those animals that were raised in a factory farm. Now, how do we really skyrocket B12? Because there's people who get injections, there's individuals who are taking supplementation with this, but how are you going to get the absolute most success at skyrocketing B12 if you want to get it higher today? Well, one of the things the research shows is that if you actually get B12 tablets and you put those under your tongue and you suck on them almost like a little candy under your tongue, then you'll find that that gets directly into your bloodstream and then skyrockets that B12. So it's one of the best ways because, like I said, there's a lot of people who go and get injections of it. And I've seen people who get injections have great success with it. It feels great. They have tons of energy after they get it. However, it still isn't as effective as simply getting a capsule, a hard-packed capsule, putting it under your tongue and just sucking on it until it's gone. So that is one of the fastest and most efficient ways according to the research. I'll put some resources in the description below to some of the stuff we use clinically. And this is how you're going to optimize B12 and avoid all these symptoms that really should be avoided to begin with. You just have to make sure you're doing the right things to take care of your health. Now you know. Now, if you like this video and you like the idea of improving your health daily, be sure to subscribe, give this video a big thumbs up, and also check out this video over here next.